Hi, I'm Dr. Dave Campbell. We're going to bring you a Health Minute today. Today I have Jon Clarke. He's a Navy Corpsman, fresh out of the U.S. Marines and the United States Navy, if I can say that.
Can.
And now working here in Jupiter. But today I'd like to talk about the topic of heroin, opioids, and the scourge of disease problems we have in the United States.
Right. There have been an increasing number of accidental opioid overdose deaths. This is a problem that is faced globally in Europe and Ireland and obviously here in the States. So my question to you is what more can we do to address this issue of accidental opioid deaths?
I think importantly, we recognize that opioid addiction is a disease. Once we make that recognition and definition, the healthcare providers, the government, family members can bring to the table all of the tools used to treat that disease. If we stigmatize opioid addiction, alcohol addiction, nicotine addiction with tobacco as something other than a disease, we miss an opportunity to provide treatment. Prevention, yes, very important. It'd be very nice to prevent opioid addiction in the first place. Doctors have a responsibility. The government has a responsibility. People with their own self-responsible positions also have to give some effort into this.
Right, right. To date, what is being done to treat this? And is it, in your profession as a doctor and as a healthcare provider, is it treated as a condition or an ailment, having an addiction, or is it how are we treating it today?
It's a little of both. I'm a spine surgeon, so I have a lot of patients who are on chronic opioid treatment for chronic pain with no access or availability of other means to treat it. That's a problem. Also, I'm a spine surgeon, I'm an orthopedic surgeon, so short acute doses of opioids are necessary when somebody is recently injured, severely injured. Everybody would agree, you're a Navy Corpsman. An injection of morphine makes sense when you have a leg dangling off you or you've been shot in the arm, of course. Going from preventive measures to stop the opioid addiction in the first place, a lot of that responsibility comes to healthcare providers to be judicious in how we prescribe opioids in the first place. Very recently, a guideline has been recommended, which I agree with, to not prescribe more than a few days of opioids, pain pills,
sure, and
also not to provide more than a few days of opioids and not to throw in it Valium or a benzodiazepine.
Okay.
So little things that we need to tweak in the system to minimize the number of people who become addicted to opioids. Once they are, then that's a whole nother issue where we have to be able to provide rehabilitation, treatment, or even, I think this is the crux of the matter, to lower the number of accidental opioid overdoses, often caused by synthetic fentanyl that has been laced with heroin, or synthetic fentanyl, which is up to 100 times stronger than heroin, which is stronger than morphine.
Okay.
If we recognize that chronic opioid use is a disease, then we provide treatment and access to treatment so that the opioid addicted individual does not have to go into the black market to buy their heroin, to buy their fentanyl, and next thing you know, to accidentally overdose, which is happening every day in the United States, and I would guess in Europe.
Absolutely. Okay. Thank you, Dr. Dave.
Okay.